A lot of people want to know how to stop a nosebleed. And you need to know, we live in Minnesota, winters are cold, the membranes dry out, they crack, they bleed. Everybody in Minnesota is at risk for a nosebleed in winter. The basic principle stopping a nosebleed is to let the blood pool so the chemicals in the blood can interact with each other and form a clot to stop the bleeding. Blood that's flowing won't clot. So the very first thing we want to do is use a combination of posture and pressure to stop the blood from flowing, let it pool, and let a clot form. Sit in a chair so you can put your feet flat on the floor. Lean forward with your elbows on your knees and put your chin on your chest as far forward as you can. So you're looking at the floor right between your feet. In that posture, gravity will draw all the blood forward. For it to drain into the throat, it would have to go anti-gravity. So we want all the blood coming forward. And then to get it to pool, you pinch the nostrils closed so no blood, not one drop of blood, can come out the nose. Feet flat on the floor, elbows on your knees, chin on your chest, pinch the nostrils closed so no blood can drain. If it's still dripping, you have to readjust your grip. If it's dripping, you're not going to get a clot to flow. Pinch the nostrils closed so no blood's flowing, and hold it steady for 20 minutes. Use a watch or a clock. If you don't use a watch or a clock, 45 seconds will feel like 20 minutes. You got to use a watch or a clock. A lot of people will recommend you use some Afrin nasal spray, the vasoconstricting spray that you can buy over the counter, Afrin, neosynephrine. Put a little bit of that in there first. Then pinch the nostrils closed, tip your head forward, hold it for 20 minutes by a clock, then let go. If it's still bleeding, hold it for another 20 minutes, then let go. If it's still bleeding after that, call us.